All right, so welcome everyone. It looks like most of the folks we were expecting are here, which is great. So like I was saying, if you haven't had a chance to look at our recordings or you've missed meetings, you can go to nhscares.org/archived minutes, archive-minutes, and you'll be able to see the minutes and the recordings as long as we're doing Zoom, which I don't foresee us changing that for a while, so you'll be able to see the recordings there. We have a lot of old business that we need to go through. So I'm just going to start off with our sector rep updates. I see we have Dr. Lentz on and Mallory. I'll start with Mallory because I see Dr. Lentz is still got his screen off. Mallory, do you have any updates as from the SEA standpoint?
Not really. At this point, I would just say, we continue to work with our providers in virtual service delivery. And hopefully maybe by the end of the week, I am going to have some updates on some additions we're putting onto our prevention website. So Zach, if, I'll certainly send that your way, and it'll be, some more resources and more information that you can share with everyone. But I think that's it for right now.
And Mallory, can you just real briefly talk a little bit about the coalition meetings that we're doing?
Oh, sure, yeah. So yeah, we started for the past couple of months having all of the active coalitions in Bucks County come together. So of course, NHS Cares and a few of the other coalitions that are representing the Chamonix School District, Council Rock, Bristol. And so far, I think it's been really productive to have everyone be able to come together once a month to talk about the different initiatives that the coalitions are participating in, and more importantly, I think how we can work together and make sure we're sharing uniform messaging and consistent messaging across the all of the different communities, and looking forward to possibly a new joint logo and how we can work on some new initiatives in the future together. Does that cover it, Zach? Is there anything else?
Yeah, I think. Thanks, Mallory. I appreciate it.
Thanks.
Dr. Lentz, if you could give us just an update from the school standpoint, how things are looking for you and involvement with the coalition.
Sure. Not a whole lot new to report from our last meeting. We reopened last week, so that's helpful in terms of being able to provide services to our students through the various programs, including this one. We're continuing to monitor where we are with the pandemic. So that obviously has been the major focus. So not a whole lot has happened lately because we've been trying to get through that process. And the numbers continue to grow, which is also concerning. So fortunately in district, we have had minimal cases. We've been very fortunate there. But we continue to watch what's going on more globally and in the county, where the cases are increasing pretty dramatically. So that's been unfortunately our focus right now, Zach. So there hasn't been a lot else going on to report.
That is okay. I appreciate that update. It's helpful. And obviously it's helpful for us to work so closely together and be able to communicate well. So I appreciate that. Obviously, in our new business, we actually have on our agenda to talk about COVID guidelines and to talk a little bit about how that might affect our work. So that'll be helpful to have you at the table for that. Also, Allison Campbell may join us. If she does, we'll go back and let her give any updates that she has. Allison is our parent sector rep, so we can give her that time if she shows up at some point. So we'll move on to board member updates for now. I think Pam is on the call and Jonathan are on the call. Just wanted to give them the opportunity. If either of you have any updates, feel free to jump in. Oh, Allison's joining us now. Anything from Pam or John?
No, I don't think we have anything at this particular point in time, although we are scheduled to get a year-end kind of broad-based update, just waiting on the new grant to see where we go and what needs to be done going forward.
Okay, thanks, Pam. Also, I think just what would I think also qualify would be just letting everyone know about Ingrid, Pam, and
Okay.
our plans there.
Yeah, so Ingrid, who has been our administrative assistant, a wonderful administrative assistant, has
Oops. Pam, I think you're muted.
how's that? Is that better?
There you go. Yep.
Oh. So Ingrid, our administrative assistant, has some things going on that she felt it necessary to step away from her position with NHS. So we we have been fortunate enough to interview an individual, Meredith Finnegan, who comes with terrific credentials to replace her. So doesn't look like we're going to skip a beat, and so it looks like we should be able to continue to keep that role fully running and moving forward. So yeah, that's pretty much it.
Thanks,
Anything
Pam.
else, Zach? Or
I think that's it. Yeah, thanks, Pam. I appreciate it. So we're in the process of bringing Meredith on. So hopefully in the next meeting or so, we'll be able to introduce her to you all. All right, Allison joined us, so I want to give Allison a minute if she has any updates from the parent standpoint, or even the vaping task force or the communications task force, since Allison has been pretty heavily involved. So
just a couple of things for this group, and apologies as I was trying to toggle between work and making sure that I had the right
Thanks for joining.
the link here. But a few things from my standpoint. I think the NHS Cares team did a fabulous job on the posters for vaping. And I had an opportunity to share that with the PTF group with Mr. Sire on the phone last week. And it's just getting those posters over to them. So kudos. And I think that was Rebecca who did that work. So anxious to get in there and get those vaping posters out there. I think, given the PAYS survey and the data that we're seeing with marijuana usage, what Rebecca also did was prepare some informational posters, and I think we're just as powerful on the marijuana side. And, did you know? Which I think will be very effective kind of as the next stage of that poster campaign. The communications, working with Kathleen, I think we had some great articles on, the impact of marijuana and maybe what parents need to know. I think, Zach, one of the things that could be a priority is making sure that we're refreshing that distribution list for NHS Cares. As I just did a sample of, hey, reaching out to a couple of folks who I thought were on the distribution list, the response back was, no, I didn't see that. So and we also have from the town hall meeting that we had back in the spring, just making sure that we can build that email list up, because I think that's where parents will, in the community, will be getting that information. Although the school is a great kind of link, and the weekly updates that they put out for community events and other, not all parents are clicking on those links and taking the time to really get to the information that I think NHS Cares needs to connect them with. And then lastly, there, and obviously with the election and the forget what the right term is in New Jersey, but the approval of voters of recreational marijuana in New Jersey. And then with the lieutenant governor here in PA saying, or at least kind of opening the door to maybe Pennsylvania voters would want to have the opportunity to choose that also for their states. There was, to build on that, medical marijuana, and here in Solebury, I sat on a planning or listened to a planning commission meeting where we have someone coming in looking at a real estate right there on 202 in Solebury and proposing to the township, a medical dispensary. And really interesting to hear some of those things. I'm not sure if all parents are aware and what NHS Cares role could be in providing an opinion and maybe, I don't want to say some direction, but obviously I think we would have a voice in that for the community. And so that's a lot bundled up into. Allison, do you have anything?
Yeah, we can, we'll unpack that a little bit. So the vaping task force, like Allison mentioned, we had some of our interns working on a variety of things for the vaping task force. One of them was the prevention campaign materials for vaping, and they seem to be ready to go. Becky, who is one of our interns, is working on basically the rollout calendar for that. So we're looking at trying to rotate those materials and make the best use of them as possible. So with students being in person, being able to actually put physical flyers up on the walls in the school would be one of the venues where we'll be advertising that material. But we also are looking at social media and the virtual announcements that students receive through their school Canvas platform. So what Becky is doing right now, and the hope is that we will to roll this out by the beginning of the new year at the latest. So the goal is that, at any given time, those are being rotated. So it's not like you're seeing the same image over and over and over again. You're seeing a different one, and then it'll switch around. As far as some of the other vaping task force materials, we are starting to transition to the resource packets now that the campaign materials are done. We've talked about creating resource packets that the school principals would have in their offices. So if they were to meet with a parent or someone who is concerned about this for their child, then they would be able to just provide them with that packet of materials that would tell them all about the substance that is, being discussed, whether it be, vaping materials or marijuana or alcohol, that there would be an individual packet for each of those. And then be able to give them resources about follow-up or next steps. So we're working on that next. We had also talked about looking at our Coaching for Excellence program, which was a program where we were providing materials for coaches to engage with their students. We're kind of on hold. Thanks, Mallory. Kind of on hold with that to some degree, just simply because of resources. So we want to do the resource packets first and then go back to that Coaching for Excellence piece, especially because sports have been kind of an interesting thing right now anyway. So we didn't really want to, I guess, get in the middle of that right this moment. The next thing, the communications piece, Allison, you mentioned the newsletter went out. Just to give you an idea of what you were talking about. Dawn asked a question. So Dawn's asking, when kids vape, do they get high, or is it like smoking a cigarette, or does it depend what you put? Yeah, so that's a good question, Dawn. When we talk about vaping, we have to specifically mention the substance that we're talking about. So vaping is a delivery mechanism, and substances vary. So it depends. But what we are seeing in our, in our survey data is that, there's kind of this progression from, younger students say that they're either, vaping just flavors, or they're not sure what they're vaping, and then a progression to, tobacco as they get older, and then a progression to marijuana use in their vape. So that's kind of what the numbers are telling us. So, and it makes sense as far as what we know, as far as gateway drugs and things like that. So that's what we're seeing. As far as that newsletter, I did want to just mention, so we had a 35% success rate or open rate for our newsletter. That's about 80 people open it and read it. I think follow-up for that, Allison, would be, and Dawn, actually, you'd be really helpful for this too, would be to look at, talking with folks that parents or people in the community that and seeing if anyone else would be interested in receiving our newsletter or our updates. And if you then, kind of put together, like Allison, you said you spoke with a few people and you were surprised that they weren't receiving it. If you then ask them, hey, would you want to be added to the newsletter, and let us know who those people are and their emails, then we can definitely add them. And then we'll be able to hopefully increase the spread there. Another question from Dawn is related to CBD. So that is a good question. CBD and THC are the two primary components in marijuana. And generally speaking, the way that it works is if the same level of CBD is present as THC, then it's a pretty neutral, it kind of balances it out. But what we're seeing with marijuana is that the presence of THC is significantly higher than CBD. So CBD is not really the kind of hallucinogenic or the component in it that gets you high. It is kind of the depressant side of it. So like I said, it kind of balances it out. But the marijuana that we are starting to see has a higher rate of THC, and that's why it's really concerning. It's not the marijuana that we, that you would maybe have known from the 70s or whenever. It's not that anymore. It's very different. So that's kind of the situation there. The next thing, Allison, did I hit everything that you kind of touched on there? I think so.
Yeah, you did a much better job of connecting the dots. So thank you.
Yeah, no problem. No, it's helpful for us to have that conversation. So yeah, and Dawn, if you can bring it up at the PTG, that would be great. Dawn, you've got great questions. I am not sure. Maybe Mallory would know this. I don't know about Molly in vape products.
Yeah, I mean, I really haven't heard anything specific to like a new trend. I would not be surprised.
Yeah.
Certainly we know that there's lots of mixing and cutting happening with just drug, fentanyl and heroin and all of the others in general. So I would not be surprised. It's not something I've been hearing about though.
Yeah. Thanks, Mallory.
Been like crushing of pills, and then you crush the pills and then you mix it with your liquid, and then I don't know.
I
don't understand how you get high and triple at the same time, but
thanks, John. Yeah, John just put a good article in the chat there.
I'm like the least knowledgeable drug person in the whole.
I think generally speaking, what we are seeing is students or youth there's not as many youth that are actually mixing their own vape materials, the substances. A lot of students are just purchasing, especially there's a lot of juuling. So a lot of students are purchasing kind of the pods that are already put together. There's probably a smaller percentage, but we don't really have a lot of data about that. And that actually, we are working right now on a follow-up survey that we can put out to our community to try to basically do follow-up questions to the PACE things that we're not really sure of or we want more information about. So that might be an area where we could explore a little bit more about just specifically like if students are mixing their own vape juice. I'm not sure. It's definitely a possibility because I know people make their own vape juice, but I think as far as the youth, go, it's not really, I don't think it's a really big focus for them. I think that they're buying, pods and using those.
And
That's
I'm sorry, Zach.
yeah.
One of the other questions from parents who were naughty, and I know we had a good attendance at the meeting with the guest panel for the pays, but I had multiple questions from parents saying, how can I get a link to that recorded session? I'm interested. Was there communication that came out on that?
Yes, I do believe so. Sarah would know.
All right, I'll follow back
better.
up with Sarah, and I would love, be great to maybe have the school send that out. If you didn't get a chance to see the PAYS webinar, here's where you can find the PAYS survey, and here is a recording of the session.
Yeah, that's a good idea.
I actually did just get it uploaded onto our YouTube yesterday, and I have a mailing ready to go out that says, if you missed it, come check it out. So that should be out today.
And on the school blast, that can be, if you missed the PAYS survey, or if you missed the PAYS presentation, here's your link.
Yep,
that would be awesome.
Yeah, if you can send me that, that would be great because I can get that out.
Okay, thank you.
Thanks, Dr. Lenz. Thanks, Sarah. Yeah, that's great. So we want to talk a little bit about just follow up to the PAYS. But before we do that, I wanted to talk a little bit about the community coalition that a number of you are actually involved with. So Lindsay, if you could give us just a quick update on the Normalcy Task Force and the work that's been happening there.
Hi, yeah, of course. So the Normalcy Task Force still exists. I think the Normalcy Task Force is adjusting to the new normal along with everybody else, trying to figure out what can be done and when and how safely. So currently working on figuring out what can be done, not outside, or if outside, when, kind of thing. Additionally, just looking into things that would be done at this time of the year. So kind of bringing the old normal to the new normal. You're on mute, Zach.
Thank you. Do you want to mention anything about the run that you're thinking about?
Yeah, so we have a few ideas for, so one thing we were thinking about potentially doing is a asynchronous run or a walk, something that's typically done around this time, like a turkey trot type thing, or maybe for the holidays. Additionally, I was thinking about potentially doing some sort of non-perishables fundraiser, kind of like penny wars, but using non-perishable goods. That's something that's to be worked out with Fisherman's Mark. But yeah, so we're kind of just brainstorming at this point.
Yeah, and actually, that's a great transition. The other big thing that's happening with the Community Coalition right now is, I think, the food drive. And actually, Janice is on the call. Janice, is it okay if I could ask you, you probably know more information because I think you've been in touch with some of the folks that are working on that. Could you just let us know anything that you know about the food drive?
Yeah, we're busy collecting mostly our staff. We're getting 20 meals together for the families that were identified by the school, the neediest. So we have complete dinners like turkeys and the whole 9 yards. So we have to have that ready for this Friday. So
okay,
and we'll be all set for that. And then Fisherman's Mark needs cleaning supplies. So
okay.
We're going to be doing that after this. So yeah, and it's been
Perfect.
great. I mean, it really has been a wonderful gift to us to be able to be involved in this. It's been fun.
Perfect. Thank you, Janice. I appreciate it. And I think also the New Hope Community Association is also involved and trying to help with that, Dave Hansel. So that's been a great collaboration that we've seen come from the community coalition meetings that we've been having. So there are a few things that we wanted to talk about. We had 2 big presentations this past month, so we want to debrief a little bit about those. So the It Pays to Know presentation, the feedback that we got from that, from the folks who filled out the evaluation, was really good. We had basically 8 to 10s in all of our, out of 10 ratings. So those are high ratings for us. So we were really impressed with that and proud of it. There was interest expressed in upcoming parent workshops. So actually, one of our interns, Kathleen, has been working on those for us. So we'll talk a little bit about those in new business, but that was something that was expressed by parents. And I wanted to have a little conversation. Last meeting, we talked about the It Pays to Know pieces that we usually do. So that's kind of a follow-up to the presentation. We printed these pieces that says it pays to know, and it has some of these primary data points on one side, and then it pays to partner on the other, with kind of advice on how to get connected or how to work to address the problems, right? And some of you may remember those. We did that the last time that we had new pays data. So our meeting in September, we discussed, should we print these? And the plan was to print these in the new year with the hope that COVID would die down and we'd be able to make use of them. I'm curious if anyone has feedback for us about, should we still follow that timeline? Should we wait to print them still? What you all think about kind of printing those materials, or if we should maybe try to take a different approach to getting that data out in the community. Any thoughts? I guess that I could also ask the question this way: are you all, or anyone here, seeing kind of paper transmission? Is that something that's happening still for you folks, or do you think that we should move towards more digital with that piece, which would mean that we'd have to ask our graphic designer to adjust the piece for a digital rollout instead of a paper rollout?
I don't know, it sounds like the digital would be better. I mean, we here have all our materials on digital, scan, download, that type of thing.
Okay.
Just,
Anyone else? Janice, were you done? Sorry.
yeah, I was done.
Okay. Yeah, anyone else kind of agree with that? I'm trying to look for head nods or anything. Yeah. Okay. So I will reach back out to our graphic designer about that and see if she can adapt that and talk with us about making that more of a digital campaign instead of an in-person campaign. I think, depending on where we are with funding at the end of the year, and we'll talk about this a little bit, where we are with funding currently, we may still print some, simply because if we have the funding, we have to spend it by the end of the grant cycle. So if we have the funding, it might be kind of in our best interest to spend it on printing some of them so we have them. Yeah, Dawn, what are you thinking?
So when I was volunteering for the American Cancer Society, what we would do is we would actually try to get like a team captain for each block, or different areas of the community, and then that one person, like say, I don't know, like say we pick Zach, and Zach has to go knock on the door of all of his neighbors and say, hey, here's my spiel, and here's my piece of paper about new hires, and and then you kind of, it's more of like a grassroots deal. But maybe that'd be a really great marketing idea. It would be low cost. I mean, all you'd have to do is print out some stuff, and you've already got, at least 2 dozen names on your list that you could, you could bug us. We'll do it.
Yeah, no, that's a great idea,
Just an
actually.
idea. Whatever
Yeah,
you think. Because
yeah,
I think that there is a lack of knowledge.
yeah,
Yeah, I think that you don't have a high enough profile. There's not enough people who really know about you, and we
yeah,
have to get the word out.
yeah, that's helpful. And I think actually, Dawn, what we might do is follow up with PTF, PTG, and the vaping task force, because that's where we have most of our kind of community members there that might be willing to do something like that. So maybe we can look at partnering with those groups to do something like that. That's great. Okay, so and in that case, it would probably be beneficial for us to print some of those materials too. So we'll do both. The next thing is just current funding. I do want to mention kind of where we are with current funding. So it looks like with our drug-free communities grant, which is our primary funding, we're still waiting to hear back on whether or not we're getting the next cycle, so years 6 through 10 for that. They have it until mid-December, they've said, before they're going to announce that. So we're waiting to hear back from there. Our current funding through December will carry for our staff. It'll cover our staff, our personnel costs, and we'll have a little bit of money, probably between $3,000 and $5,000 for project costs. So that's where some of these printing materials and the graphic design and that type of stuff will come into, as well as some of the events that we're looking at doing to support students and things like that. So that's where we are as far as funding. We are looking at, so basically if we don't receive the DFC for this year, then we have unrestricted funds that could carry our personnel through about September is our estimate right now, which would mean that we would actually be able to apply again for the DFC because the application opens in like February, March. We could apply again and hope that we then receive the DFC funds in September, which would then continue everything for us and allow us to continue our work. So that's our tentative plan right now. There's a couple, plan A, plan B, plan C. If we didn't receive the second round of DFC funds, that's where we would really need to engage our community and do a lot more fundraising. But at least we have time. So we have basically between now and September to really start doing some additional fundraising and make sure that we're making plans to accommodate the difference in funding if we need it. So yeah, Dawn.
So I've noticed that in Peddler's Village, when they have big weekends here and there, different things, that they often allow different organizations to set up a table. And you could, set up a table there and, have like a donation jar and, a sign-up sheet, and that might make it even easier to help you get the word out and also get some donations.
Yeah, I wonder if
Additionally, I
there.
was thinking we could actually create a sign-up genius where we ask people to donate certain things, like donate a ream of paper, and you need,
Yeah,
I mean, we could do that. That would be easy.
Yeah, I'm wondering. So the only
And that
thing
would
I would need to
certainly
know
help
is
cut down your costs.
whether or not that's
Just an idea.
changed because of COVID.
Sorry, it's that
So
old
I'm wondering
marketing
if
in
they're
me
still
that's
doing
coming
that.
out.
Um,
I actually just have your own drop-off bin at the school, and then you would just have to go over there and, fetch it, but it would be outside, by the door, and people would just, throw in
yeah,
box pens or throw in some Post-its or a ream of paper. I don't know.
Yeah.
Just an idea.
Yeah, no,
So
that's,
maybe you don't like it. I don't know. It's up to you.
no, it's
Whatever
good.
you think.
And honestly, actually, depending on COVID, the Peddler's Village thing is something that I think our students might be interested in too, because they love the opportunity for volunteer hours. The only thing would be, the COVID thing. So we want to be careful about that. But it's definitely something that we can kind of talk about. We are planning a meeting with parents. And this is something we can talk about again during the Today updates, but we're planning a meeting with parents of our students in the Today groups to kind of feel them out about where their comfort level is for their students. We want to make sure that when we're planning things for them, that their parents are comfortable with what we're doing. So Lindsay is working on putting that together, and that'll give us a kind of a platform to engage folks and see what they think about their students' involvement.
I think the other great thing about having a sign-up genius where everybody gets to donate something, whether it's a box of pencils or a Post-it packet or something, is that it gets everybody involved.
Yeah.
It helps to raise your profile more. When people have to do something, they feel good, they're helping, but then it's also raising your awareness.
Yeah, definitely. So, I mean, that's definitely something that we can look at. Lindsay's actually working on, like she said, the drive idea with students too. So it could be incorporated into that. I think it'd be it would just partner well with that. The next thing on our agenda is the Faith and Prevention Summit that we did. So some of you might not know that we did the Faith and Prevention Summit, and that was basically an outreach to all Bucks County faith leaders. And we had around 50 people attend. We had 4 people of the group say that they're interested in joining a steering committee so far, and we're going to do some additional follow-up with the folks that attended to see if we can increase that number. But the steering committee would then kind of continue that initiative so that it's something that really is owned by the faith leaders in the county and not something that we continue to kind of push forward. The interest that we've seen from them is in Narcan trainings for churches, which is something that we brought up to Mallory already. And some interest in that steering committee basically doing campaigns together. I wanted to give Sarah and Lindsay some time for Today updates real quick if you can. So Sarah, if you want to start, and then Lindsay can give an update next.
Yeah, so those of you that don't know, I run the Today Club in the middle school. We've been somewhat successful doing it virtually. For a little while, we were doing Wednesdays at lunch. This week, I just sent out a survey to reevaluate that since the schedule has changed. And currently, our options are either Monday, Tuesday, or Wednesday in the period that they have either teacher office hours or other clubs. So I'm going to pick the time that works best for the majority of my students. And we also have started using Nearpod, which is kind of a cool little platform. And I'm building my meetings in there. So even if a student isn't available during the time we pick, they'll still get to have the Nearpod sent to them and get to participate in the activity. And then fingers crossed for sometime maybe in the spring, we do get back into the schools.
Lindsay, if you can give your update.
I guess that makes it my turn. Similarly, the Today Club is seeing how everything kind of plays out. We originally were meeting during lunches, and now lunch isn't a thing, so we are adjusting to the new schedule. The kids have a little bit of a break from me while they adjust to their new normal as well. But like Sarah, I'm working with Nearpod to make fun, interactive, virtual meetings happen. And once I get the ball rolling, I'm going to have them help more with our walk/run activity event and our fundraising, whatever that looks like.
We are still working on peer education and trying to find a way to deliver that virtually. Our plan basically is to let the school kind of work through any bugs that they might have with their transition back to in-person, and take a step back so that we're not creating any additional stress right now, because I'm sure that that's a stressful stressful time for them to transition to in-person and whatnot. So once they kind of get their legs under them and they're kind of moving through that new normal, then Lindsay and Sarah are working on peer education, and our interns are helping with developing that into a virtual program. So that is something we are planning on doing in the new year, still virtually. On the note of interns, we do have 3 interns. They're finishing up their time with us, and we're starting to advertise for spring interns. So we can say thanks to the folks. If you've worked with our interns at all, definitely make sure that you send them a note and just say thank you to them. They've been great. And if you know anyone that's looking for a spring internship, definitely you can send them our way. We'd be happy to have them. So that is it for old business. New business. So we did mention there's some community trainings that we are working on. Kathleen, one of our interns, has been working on parent trainings. So that's to address specific substances. So they are just about ready. And again, kind of looking at the new year for rollout of them, because holidays are just a terrible time to try to get anyone to do anything. So we're looking at, in the new year, rolling out a training for parents on alcohol, training for parents on marijuana, and then a training for parents on vaping. We do want to talk with you all about business trainings, and then law enforcement was on our action plan for a group that we would see if there was any training that we could provide for them. Our thought was to basically provide trainings on recreational marijuana legalization. So looking at what the effects of recreational marijuana legalization were in states that did legalize for that specific entity. So for business or law enforcement, what changed for them? What are things that they didn't think about? And the reason I just want to give you all kind of our reasoning for wanting to do that, if you don't remember the discussions we had, because we talked about this last year when we did our action plan, the reason for that is kind of twofold. And most people say that it's unlikely that we would legalize, but if we did legalize, we want to prepare people so they're aware, right? But at the same time, by being able to give this training, it may be a preventative effort, right? So if we are able to educate our community on some of the downsides to the legalization of recreational marijuana, then they might be more likely to advocate against the legalization. So that's why we're looking at those trainings. I would love some feedback. There are some folks that are in the business world. Obviously Jonathan is on the call. If you have feedback for us about those trainings for businesses or for law enforcement, and what you think would be best, if you think that our idea is good, or if we think we should move for some other plan there, what do you think? Or Mallory, if you have any suggestions for us too, as far as trainings that you've seen or heard of for business or for law enforcement.
Good morning, all. Can you hear me?
Hey, John.
Hello. In regards to the training for law enforcement, we go off the studies from Colorado and other states have had it for several years now, and we follow their programs. Again, it's not legal in Pennsylvania to that degree. Once it's there, I'm sure Pennsylvania will jump on board and get those trainings out to law enforcement as needed. We're watching Jersey closely, obviously, to see where they're headed, what they're doing. speaking with our local district.
John, we can't hear you.
You guys hear me?
We can't hear you, John.
Your
Zach,
voice
can
I
is
you
think
hear
you
me?
very
have to talk a
low.
lot louder. It sounds like you're whispering to your friend in the other room.
Can you hear me, Zach?
Sorry.
Yeah, when you got closer, it got a little bit better.
It sounds like I'm
Yeah,
actually
sorry.
trying to eavesdrop on my kid.
We had a couple power outages here, so it's messing with my Zoom.
Yeah.
Can you hear me now? Nod your head, yes.
It's a little
Yes.
better, yeah.
So we're working closely with our district attorney about Jersey's new marijuana law going into effect to see how we deal with that. Again, until it hits Pennsylvania, there's not much else we can do in regards to learning about it on a law enforcement basis. But once that occurs, we'll definitely be on board for it.
Okay.
You know what?
And
I'm sorry, Zach, can I interject here? So you said you didn't think it was likely in PA. New Jersey overwhelmingly approved it. So I'm wondering, why wouldn't Pennsylvania? And I'm just coming from a trip to Nevada, and it's amazing when you see the Colorado studies, and then I actually saw it kind of play out live in person in some of the places in out west. Um, I like the approach of, well, how do we educate and become our own advocates to help shape the decision? But the New Jersey, I don't remember what the percentage was, but I thought it was pretty clear that New Jersey voters really supported it.
New Jersey
yeah,
did support that. The difference between New Jersey and Pennsylvania right now, let's get into politics. You have a Democratic supermajority in New Jersey that put this up for the public to vote on, where Pennsylvania, we still hold a Republican majority, more conservative
In the state.
in the state. So for that to get up on a House bill, it's going to be a long, tedious task. I'm not saying it's not going to happen,
Yeah.
but it is in our advantage at this point. That
Gotcha.
yeah, and that's actually also exactly how
Let me ask you
Matt Weintraub put it when he was speaking at the
Okay.
PAYS event and the Faith Summit event too, is, we want to be aware of what the possible implications would be if it happened. But at this point, we're operating under the assumption that it's not going to happen right now. It's not really a huge priority for us. But for NHS Cares, I think it's something that we can doing to try to advocate against, right? So for us, it's still a pretty big priority. For law enforcement, because if it were to happen, it would take a lot. So it's not a huge
And
priority right
then
now.
can I push this a little bit further? Do we have a point of view on medical marijuana and dispensaries? So as I was educated after, I think it was like a 2-hour and 45-minute call on zoning and application process to be able to stand up something like this, I was surprised that it only had to be 1,000 feet from a school. And I think it was 500 feet from, I don't know whether it was a bus stop or a residential or whatever the requirements were, but it seemed like it was pretty open to wherever you could put these. And as much as you control, it also comes with a significant amount of challenges around it. So thoughts on that, Zach?
So New Hope Solebury Cares, traditionally, the stance that we take in regards to marijuana is we generally we're relatively neutral on medical marijuana, right? Because there are pros and cons, there's benefits, and there's a lot to that issue, especially because at the federal level and the state level, there's disagreement. So there's complications to it, right? So traditionally what we do is we take a stance on youth use of, recreational marijuana. That is our hard stance is, we're opposed to youth use of marijuana. And that way, we really don't get into a lot of conflict around it, and we're able to kind of advocate against inappropriate use. There is, we as a coalition, we have the ability to advocate for policy change. So especially, there's some of us who can't, right? So there's not a lot that I can do as far as being federally funded. There's kind of nitty gritty details to that, but volunteers have way more ability to advocate for policy change. So if you wanted to look at policy change specific to kind of proximity of medical dispensaries, that is something we could talk about. But again, that is not something we've traditionally looked at, is the medical side to it. So what I would say is, if that's something that we are interested in talking about, I would want to make sure that there's research around the medical dispensaries and youth use, because our
the
camp
impact
is
to that
usually
local
youth.
Yeah.
Right.
So
And that
curious.
if that's something as a coalition we're interested in, then what we could do is, as we get new interns in the spring, we can ask them to do a research project around dispensaries, medical dispensaries, and youth use and proximity and things like that, and then bring that data back to the coalition and talk about, if there is a need for policy change or advocacy in that way.
Okay,
I think that
thanks,
would
Zach.
be the approach that we should take. Yeah.
I think that's most productive.
Okay.
Thank you.
Yeah.
Zach, could I just
John,
say, so I think that in terms of time management and where do we focus, I think everything that I've read basically, and given the condition of municipalities because of the COVID situation, because of job losses, because of restaurant closings, I think the inevitability of seeking other resources for income is out there, and marijuana obviously poses one that a lot of municipalities are looking at. So I think we need to not necessarily get involved in the weeds of the political position, but focus more on what we do and preparing that if it does happen, reaching out to like physicians who have to write the prescriptions for, for the medical
cards.
usage. I think we should focus on being ready to provide information, resources, why it's there, how it's there, and kind of be the cornerstone for those resources for the schools, for doctors, for things like that, as opposed to getting involved more in the political weeds of the situation.
Yeah.
That's a good point, Pam.
I think what we've done, thanks, Dawn, for joining us. I think what we've done, and the approach that we've been trying to take is exactly what you're mentioning. Basically training people, educating people, specifically our youth and our parents. And that's why we're also looking at kind of expanding to businesses. And, if at some point law enforcement is interested in having some sort of training, we were hoping to do lunch and learns to make it more more appealing for officers to want to come join us. But obviously lunch and learns are kind of an out thing right now with COVID, unless we deliver food. So, but we were looking at basically doing the education side, and then allowing those who we've educated to be able to be a voice. So the youth in particular have been interested in advocacy work, and so kind of giving them the tools and the resources and letting them be the voice. So that was kind of the plan that we were going to take. It sounds like you all agree with that. It sounds like business might be a good place to start, because law enforcement, you have your hands full with some other things right now. So that's where we will probably focus, and we'll kind of go from there. We have about 4 minutes left, and some folks are having to drop off. I do want to just mention a few other things as far as new business goes. So we are starting to look at fundraising a little bit more. There is a Giving Tuesday campaign that we're starting to do. If you're not familiar with Giving Tuesday, it's kind of like a Black Friday, but for donations. So the Tuesday after Thanksgiving and Black Friday, there's a nonprofit that basically pushes out communication for fundraising and gift raising, donor raising. So we are jumping on. We've joined the Giving Tuesday platform. So if you would be really helpful would be if you could push out the communication for us as you see it. We'll be using social media a lot. And also what we would like is to look for folks who want to share their stories about why New Hope Solebury Cares is important to you. So if you would like to be one of those people, that would be really helpful for us. It would just be a quick video, like 20-30 seconds, just hey, this is New Hope Solebury Cares to me, and this is why on Giving Tuesday I'd like to support New Hope Solebury Cares, something along those lines. So if you would like to join that or be a part of it, just let us know. We'll need to do that in the next week or so we can start pushing out that communication. The next thing that I wanted to mention is just COVID, and what I'd like to say is, just for the sake of time, if you would like to give us suggestions around changes to the way that we're doing things, or what you're thinking about the changing COVID guidelines, I think we've been pretty conservative in what we've been doing, but if you want to follow up with an email or a phone call to myself or Sarah and let us know what you're thinking, that would be helpful, so that we can kind of continue to adapt based off new guidelines, right? The last thing that I really want to ask is meeting times. We have a pretty good attendance for this particular meeting. Our next meeting is supposed to be January 27th, but it's a little up in the air as far as what time. So I wanted to know if this is the best time for everyone, if we should keep the 10 o'clock meetings, or if the evening meetings were better for some. So I will just say head nod if you'd like to keep the 10 a.m. meeting. Okay, head nod if you would like to move to an evening meeting. All
Yeah,
right,
either
your
is fine.
votes. Okay, your votes are cast. We'll look at the recording and make sure that we take official record of who voted for what based off your head nods. And that is all that we had for our meeting today. Like I said, it was pretty packed. I'll hang out. What we'll do is thanks Mallory. Thanks everyone for joining us. What we'll do is I'll turn the recording off, and we can, we'll hang back if anyone has questions or anything. But thanks for joining us, everyone. We really appreciate your time today.
Thank you.
Thanks, team.
Thank you.